Just scanning the room. Okay.
Okay, knock on the door, wash my hands. Hi, my name is Brianne. I'm going to be your nurse today. Is it okay if I do a quick physical assessment on you? Okay, awesome. What is your name and date of birth? Check the ID band. Okay, great. My patient appears to be his stated age. He is smiling at me. He shows no signs of distress and he is cooperative. Do you know where you are? Yep, you are in the hospital. And do you know why you're here? Awesome. And then do you know the time of day? Okay, awesome. It is the morning. My patient is well groomed. He has good hygiene. It appears that the CNA was just in here with him. He is sitting upright in bed. He ambulates by himself, so he uses no assistive devices. He is bilaterally symmetrical, and then while I've been standing here with him, he shows no signs of involuntary movement. I'm going to start by getting a quick set of vitals on my patient. So I'm going to start with the apical pulse. I'm going to start on the left side midclavicular, fifth intercostal. I'm going to listen for a full minute. Right here. All right, his apical pulse is 76 beats per minute, which is what we want it to be. We want it to be in between 60 and 100, normal rate and rhythm. I'm going to check his radial pulses bilaterally. These are also 76 normal rate and rhythm on a 2+ scale, also within normal limits. I'm going to assess his chest for respirations. He has 18 within normal limits of 12 to 20. Then I'm going to assess his oxygen. So I'm going to put the clip on his finger, let it read. All right, and he is sitting at 99%, which is within normal limits of 95 to 100. Then I'm going to take his blood pressure. I'm going to assure that the cuff is aligned over his brachial artery. He's kind of like laying on this, so it's a little difficult, but it'd be over his brachial artery here, and his blood pressure is 120/80 within normal limits, and that shows no concerns. Then I'm going to take his temperature, so I'm going to take it orally underneath his tongue, so sublingually. His temperature is 97.6. I can take it temporally, tympanically, axillary, and rectally if there's no other contraindications. So if he was wearing a hat, if he had any surgeries to his head, if there was any skin breakdown or lesions, I would not take it on his head. I wouldn't take it in his ear if there was ear pain, drainage, an ear infection. I wouldn't take it in his mouth if he had any mouth sores, mouth surgeries, anything of that nature. Axillary, I wouldn't take it if he just had a breast surgery, if he just had open heart surgery, things like that. And then I wouldn't take it rectally if he had visual hemorrhoids, GI discomfort, rectal bleeding, things of that nature. I'm going to move on to his head now. So I'm going to inspect his head. His overall shape is normal cephalic. Everything looks good. His facial features are symmetrical. I'm going to inspect his head and his hair and his scalp. Everything is clean. His hair is abundant, long, and soft. There's no breakdown of the scalp. Everything is clear there. His lips are pink and moist. There's no skin breakdown. His neck is symmetrical. His shoulders are even. His trachea and substernal notch are midline, so that's great. I'm going to start by assessing his eyes. So his eyebrows, his eyelids, everything is aligned and positioned appropriately. So I'm going to check his pupils. So the lights would be dimmed. I'm going to flash it over that eye. Awesome. And then I'm going to do it again and check the other eye. Awesome. Same thing. Good. Good. His pupils are equal, round, and reactive to light. I'm going to check to see if they are accommodating. Go ahead and follow the tip of my pen. Awesome. Then his eyes do accommodate. There's no lacrimal drainage. His conjunctiva is clear, and then the sclera is white. I'm going to test his EOMs now. So this checks his cranial nerves just to make sure everything is intact. You can go ahead and follow the tip of my pen. You're going to make kind of like a snowflake, bringing it back in. This just tests his fields of vision. And then we want to keep his head still just so it's his eyes following. I'm going to check his nose now. I'm checking for patency. Everything is clean. His mucous membranes are pink and moist. His nose is not deviated. His septum is midline. All right, I'm going to check his mouth now. I'm looking for his sublingual and buccal mucosa that are pink and moist. His hard and soft palate are pink and moist. His uvula hangs midline. His tonsils are absent. His teeth are his own. There's no signs of decaying loose teeth or dentures. And then his gums are healthy. Everything is good there. Then I'm going to move to his ears. I'm going to inspect his lobule, auricle, and tragus. I'm assessing for drainage, lesions, things of that nature. Everything looks good. Any pain when I push on your tragus? No. All right, then I would check bilaterally. Any pain here? Nope. No pain. Awesome. No drainage, no crusting, no lesions. Based on our conversation, my patient can hear me well. I'm going to check his auditory acuity by whispering in his ears. 1, 2, 3. He would repeat 1, 2, 3 back to me. 4, 5, 6. And then he'd repeat 4, 5, 6 back to me. So my patient is able to hear me well, and then I'm going to check the range of motion of his neck. So I'm going to have you touch your chin to your neck like this. Maybe he can do it. Okay, kind of can do it. Awesome. And then he's going to turn his head towards my hand and check for resistance, which my patient does not have. All right. I'm going to move down here. My patient is sitting up in bed. He shows no signs of distress while he's sitting here. He is easily able to breathe while he's in supination, pronation, and in upright positions. There's no cough, no sputum. I'm going to do his jugular vein dissection now. So he would be laying down. I'd remove the pillow from him, and I'd look right about here and see if there's any pulsations. Then I'd be able to sit him up at a 30-degree angle to assess for any pulsations, which he doesn't have, so he's free of that as well. His neck is good. I'm going to assess his carotid artery. I'm going to do one at a time, just so he doesn't pass out. Normal rate and rhythm on a 2+ scale. Normal rate and rhythm on a 2+ scale. And then I'm going to assess his lymph nodes. So we have preauricular, postauricular, occipital, submandibular, submental, anterior cervical, posterior cervical, tonsillar, and then supraclavicular. Everything is good. There are no concerns. Now I'm going to inspect his chest. I'm going to palpate. I'm looking for masses, tenderness, and crepitus here. So palpate, palpate, palpate. And then I'm going to palpate the 5 cardiac landmarks, and I'm looking for crackles. I'm looking for crackles and his breath sound. So I'm going to start on the right side at the second intercostal at the aortic here. Everything is good. Move over to the left side, second intercostal at the pulmonic. Move down to the left side, third intercostal at the Erb's point. And then left side, fourth intercostal at the tricuspid. And then left side, fifth intercostal, midclavicular at the mitral. Everything feels good. And now I'm going to auscultate his lung sounds using the ladder technique, listening for 1 inhalation and 1 exhalation. I can note that his skin color of his face and his upper chest is appropriate for his ethnic background. So I'm going to use the ladder technique here. I'd also listen posteriorly, anteriorly, and laterally. I'm going to listen to his heart sounds now. So we will do here, aortic, pulmonic, Erb's point, tricuspid, and then mitral. His chest shape is a 2-to-1 ratio. And then I'm going to check his chest expansion here. So you kind of make a W. He is symmetrical. His breaths are normal. There is no concern, no abnormalities there. Everything looks good. I'm going to move down to his extremities and assess the arms and hands for the color, which are appropriate for his ethnic background here. There are no deformities. The hair on his extremities are appropriate for his skin color, and they are healthy. There is no concerns. I'm going to assess his hand or his fingernails and his toenails now. There is no signs of clubbing, nothing like that. And then I'm going to assess his capillary refill on all 10 fingernails. Returns in less than 3 seconds. And also returns less than 3 seconds. Check his toenails. Returns less than 3 seconds. Same thing, returns in less than 3 seconds. So now I'm going to look at his abdomen. I'm going to inspect him here. I'm looking for the contour and symmetry, so he is symmetrical. I'm looking for the color and pigmentation appropriate for his ethnic background. I'm looking for pulsations, petechiae, masses, bulges, tenderness. His umbilicus is midline, so that's appropriate for him. And then I'm going to assess his genitals. So his tissue is healthy. The color is appropriate for his ethnic background. He has no drainage, no lesions. He did urinate about an hour ago, and it was clear yellow with no odor. He had a bowel movement early this morning before change of shift, and it was a large brown formed bowel movement. So that's good. I'm going to listen to his bowel sounds now. I'm going to listen in all 4 quadrants, starting in the right lower quadrant. So I'll listen here, right upper, left lower. His bowel sounds are normal and active, so that is great. I'm going to lightly palpate his abdomen for masses, tenderness, and bulges. So I'm going to use one hand, following 9 quadrants here. And everything is good. Now I'm going to assess his extremities and his gait. So his gait is even and steady, no concerns there. When he does the Romberg test, he is negative, so he has great balance. I'm going to assess his extremities for any edema, swelling, anything like that. I'm going to check for his edema on a bony prominence. No edema is present. I'm going to check the temperature of his extremities as well. So I'm also going to use the back of my hands, going up his legs. I can do his chest, I can do his abdomen, his arms, and he is warm. I am going to assess his grip strength. So he can go ahead and squeeze my hands and go ahead and push them away. Go ahead and push my feet to the ground and go ahead and pull them up. And then I would also assess his pulses. So I would assess, I did the radial and the apical, so then I would do the femoral here on the insides, rate and rhythm normal on a 2+ scale. Popliteal, rate and rhythm are normal on a 2+ scale. And then posterior tibial, rate and rhythm is normal on a 2+ scale. And then pedal is normal on a 2+ scale as well. Those are all well. His grip strength and his hand strength with his hands and feet are equal bilaterally. And then we would do range of motion. So we would do flexion, extension, pronation, supination, and circumduction of the shoulders. He is able to perform that well. And then that is everything that I need to do. If he has anything that he needs, he has his call light, his TV remote, his cell phone. I'd put his bed back down in a normal position at a safe height for him. I'd put his rails back up, cover him back up. If that's all he needs, I'll be back in 30 minutes. All right, are you good?